My name is Jennie and I'm one of the nurse advisors at Primary Care Recruitment. I worked in the NHS for several years. My focus was within surgery and critical care, and now I work as a nurse advisor for Primary Care Recruitment. Primary Care Recruitment is a recruitment company who've been specialising in medical and nursing recruitment for several years. We supply nurses to the United Kingdom, to the NHS and the care sector, also to Ireland, Belgium and Germany. And we also supply physiotherapists and doctors to France and also areas of the United Arab Emirates. We have offices in Dublin and Porto, and we have representatives that work with Croatia, Serbia, Hungary, Romania, Poland, Italy, Spain, Cyprus, Greece, and a few other countries. You can apply for a job directly to an ad, or you can apply with your CV and to have consideration for different offers. You can submit your CV in English with a photo that explains your education and your experience. And one of the recruitment consultants that specialises in recruiting candidates from your country will be in touch with you and arrange an initial interview. The initial interview will cover your skills, your experience, your suitability for a job. It will explain the job offers that we have and also assess your level of English or the language of the country that you're expecting to go to, whether it's Belgium, Germany or the UK. Within the United Kingdom, we have several offers. We have offers that include care homes, which is generally the private sector, and also the NHS. And we represent many hospitals in different areas of the UK. The difference between a care home as your first job or a hospital as your first job depends on what you want out of your career. Many nurses like to go to a care home for the first year or the first 2 years to gain some experience, improve their level of English and then move to a hospital. Also, many nurses like to start within the National Health Service and start to work within the National Health Service as their first job. Your recruitment consultant can explain the different offers and can explain the benefits and the disadvantages of each thing. Working in a care home can be very rewarding, but it's not for everybody. The benefits of working in a care home generally are it's a small team, you can integrate very well, you have a consistent patient base, so your patients generally stay the same, so you can build very good relationships with them, and you can build very good foundations of good nursing care. Career progression can be the same, and salary can be the same as in an NHS hospital. We have nurses that have made deputy nurse manager of a care home and also manager of a care home, and we have nurses that have progressed well within the NHS. You may get better professional development within an NHS because they have more resources, but this is something that you can discuss with your recruitment consultant about which meets your needs the best. Generally, interviews take the same format, whether it's for a nursing home or whether it's for the NHS, and they include a drug assessment, which we will talk about in more detail at a later video, a written scenario which assesses your assessment skills and also your written level of English, and then a face-to-face interview. Usually 3 representatives come to a country of origin and they will conduct the interviews there. However, just because interviews are happening, say for example in Spain and you live in Italy, you can usually do the interview via Skype. And the interview takes the same format in that you would do a written assessment, a drug assessment, and then the physical interview. The physical interview we will talk about again in more detail in a later video. And generally they look at things like your personality, your ability to problem solve, and your assessment skills. To work as a nurse in the United Kingdom, you have to be registered with the Nursing and Midwifery Council, the NMC. And we can talk about the process of application in a later video. The NMC control and regulate the nursing profession and provide guidance on how we should behave professionally. In a later video, we will talk more about the importance of the NMC and about what it means to us as nurses. If you're interested in proceeding to try and work within the United Kingdom and you're interested in further job offers, then watch our other videos and they will help you prepare for interview and also talk about key topics that you need to know for your interviews and for when you start to work in the UK.